In recent years, the mental health of children and teenagers has become a pressing concern. With an estimated 20% of young people in the United States experiencing mental, emotional, developmental, or behavioral disorders, innovative solutions are urgently needed. One such solution is gamified digital mental health interventions, which are specially designed video games aimed at improving mental well-being. The demand for pediatric mental health care has surged, exacerbated by the COVID-19 pandemic. Suicidal behaviors among high school students increased by over 40% in the decade leading up to 2019. Despite efforts, the availability of mental health providers remains insufficient. Even doubling the number of pediatric mental health providers still wouldn't meet the need, said Barry Bryant, Maryland, highlighting the urgency for alternative interventions. Gamified digital mental health interventions are video games specifically designed to address conditions like anxiety, depression, and attention deficit/hyperactivity disorder, or ADHD. These games are available on various platforms, including computers, tablets, and smartphones. They incorporate therapeutic concepts into gameplay, such as racing games for ADHD that require multitasking, or games for depression and anxiety that teach psychotherapy-oriented concepts. A team from Johns Hopkins Children's Center reviewed 27 randomized clinical trials involving 2,911 participants aged 6 to 17. The studies, conducted globally, assessed the efficacy of these digital interventions. The research, published in JAMA Pediatrics, standardized effect sizes using a random effects model to determine the effectiveness of these games. The analysis revealed that while the benefits are modest, they offer a novel tool for improving children's mental health. For ADHD and depression, the video games showed a modest reduction in symptoms, with an effect size of 0.28. This indicates improvements such as better attention span and reduced sadness. Although these effects are smaller compared to traditional in-person interventions, which often yield moderate to large effects, they provide a valuable option for families seeking accessible mental health support. In contrast, video games designed to alleviate anxiety did not demonstrate significant benefits, with an effect size of 0.07. This suggests that while these interventions may not be as effective for anxiety, they still hold potential for further development and refinement to enhance their impact on anxiety symptoms. The study identified factors that could enhance the effectiveness of these interventions. Games delivered on computers and those with preset time limits showed better outcomes. Additionally, studies involving more boys tended to report more positive results. These insights offer pathways to optimize the therapeutic benefits of gamified interventions. Despite their potential, not all video games studied are easily accessible. Some require specific research team access or are behind paywalls. Moreover, the study noted that structured, time-limited gameplay is crucial to avoid issues like video game addiction. The researchers emphasized the importance of having multiple tools available to address the growing demand for child mental health care. While gamified digital mental health interventions are not a panacea, they represent a promising step forward in addressing pediatric mental health challenges. Having many tools in the toolbox can be helpful, said Joseph McGuire, PhD. As the field evolves, these interventions could become an integral part of comprehensive mental health care strategies for children and teenagers.